My name is Hannah Murnane and I am a general nursing student in 4th year. The title of my research project was The Nurse's Role in Medication Management in the Care of Patients with Parkinson's Disease, a review of the most recent evidence. So, the background of this research project is Parkinson's is a neurodegenerative condition with a complex pattern of symptoms involving the degeneration of dopaminergic neurons and a reduced level of dopamine. We need dopamine to move. Presently, there is no cure for Parkinson's disease and the cause is not fully understood. Medication is a really effective treatment to intervene for and support patients with Parkinson's disease to live as independently as possible. Pharmacological intervention supports people with Parkinson's disease to manage distressing symptoms such as not being able to move, walk, talk, or swallow properly. The only thing is that medication adherence for people with Parkinson's disease can be problematic, especially as the disease progresses and medication regimes become more complex. Increasing the risk of poor compliance such as wrong dose, wrong time, and increasing the risk of poor health outcomes. On the wards, patients' medications regime is complex for those with Parkinson's and often doesn't parallel with the routine drug rounds. Therefore, this highlights the need to explore the nurse's role in medication management in the care of patients with Parkinson's disease. So the research question was devised using the PO format. So P, the population, was adults with Parkinson's disease, exposure, medication management of Parkinson's disease, and outcomes was the nurse's role. The question was to explore the nurse's role in medication management in the care of patients with Parkinson's disease. The method used in the study is based on a focused mapping review and synthesis format. The process involves targeting specific journals. So I was looking at journals that were addressing Parkinson's disease and nursing management of medication and medication as an intervention for Parkinson's disease. So these subjects were specific to the articles which I chose from the journals, and I was searching within a defined time period of 2020 and 2021. So I used Scopus and the UL library to find my journals and the articles, and they were nursing focused and highly likely to contain published research relevant to nursing medication management and Parkinson's disease. So this is just a table of my chosen journals. So I found many journals on Scopus, and I adhering to my inclusion and exclusion criteria, chose these 5 journals, and then within those journals I screened 27 articles, excluded 22 and chose 5. And the aim and relevance is there. So the search and result process, there was 27 articles from all different journals which I screened, and I just read through the title and the abstract of these articles, looking for articles which met my search criteria. I read 5 articles thoroughly, and these studies met my criteria, so they were most specific to my question. So here is my data extraction table. So I used this table to kind of screen the findings and the key messages of each article. As you can see, the author, the year and the country of each article is there, the study aim and the purpose of each article, the type of study and the key messages, and this really relayed to me how these papers were most specific to my question. So what I found from all these papers was the role of the nurse in the medication management, to maintain a professional competence, to educate her patients on Parkinson's disease, to educate her patients with Parkinson's disease when meeting them on the ward, why they need to take their medications when they do, why their medication management may be more complex than other conditions, and how the kind of artificial dopamine works, and how it assists them at kind of alternative times, at kind of different times of the day, and why they need to take it at certain times. And they need to support their patient. Like, as I said, as Parkinson's disease progresses, it's neurodegenerative, so they lose the ability to talk, walk, move as well as we can, which means the nurse kind of has to advocate for a patient and ensure that they are heard and they are communicated with on every level. So the nurse provides like holistic, person-centered care. So for each patient with Parkinson's disease, she needs to find a way to ensure they understand their medication as an intervention for their Parkinson's disease, and monitor and assess the reaction to each medication and how it might suit them or be inappropriate for that patient, depending on how they're reacting. It's up to the nurse to get to know her patients and know what's normal and what's not normal in their baseline, what isn't their baseline, while also maintaining a professional competency and level of care. So, considerations for nurses' role in clinical practice that I found from this research project was: it suggested healthcare professionals need further education on medication management as an intervention for Parkinson's disease and how this disease impacts their quality of life. Over 50% of people with Parkinson's in a study by Nasby et al. 2021 had not received any pharmacological therapy for pain, although they had discussed their pain with various healthcare professionals. Hindmarsh, another author of one of my selected articles, stressed the lack of knowledge of symptom burden and pharmacological management of Parkinson's in the final stages of their lives. Nurses should receive education through a Parkinson's nurse specialist, have access to training days for understanding the disease and the medication regime to support their practice. Nurses need to be aware and knowledgeable of technical aids to support medication adherence. So one of my papers referred to an app on people's phones which remind them to take their medications, which mightn't parallel with the usual kind of drug rounds on the ward, or to remind them as I said, as Parkinson's progresses, there's risk of cognitive impairment, so they might need these extra supports and reminders to make sure they can take their medication and receive the best quality of life with their condition. And it's up to the nurse, to have knowledge of these different aids and be able to provide the patient with the best opportunities for their condition. Nursing practice needs to be holistic and person-centered focused. This will provide opportunities for the nurse to advocate for more user-friendly medication strategies and provide the patient with a voice, especially as the disease progresses, which I mentioned earlier. Patients want nurses to provide them with information so that they can make informed decisions and also become more in control of their medication taking. Patients' needs and abilities change over time, and it is necessary that nurse conducts regular assessments and implements strategies that will promote medication compliance. Those are my reference, and thanks so much for listening.